Hello, I'm Sophia.
I'm Phoebe, and we're from bamnbeyond. This is the British Asian Opinion Show, BAO, otherwise known as the BAO Show.
Today we are exploring the term BAME and discussing the government's report that claims that the BAME communities are at of higher risk of dying from COVID-19. We have asked a selection of British Asians to give their opinions.
So our interviews were conducted in July. For context, in early June, the government released a report stating that the BAME communities are at a higher risk of dying from COVID-19. We asked our participants to read through the articles published by the BBC and Sky News. These articles will be linked down in the description box below. And we got them to share their opinions with us. But before we show you what they have to say, Sophia is going to tell you the context that they were given at the time.
The first article published by Sky News on the 2nd of June stated that people from Black and Asian ethnic groups are up to twice as likely to die with COVID-19 than those from a white British background, according to a report released by Public Health England. The report's death analysis of people in BAME groups accounts for the effects of sex, age, deprivation, and region. However, it fails to include the effects of underlying health conditions, obesity, as well as occupation. On the other hand, the BBC News report published on the 19th of June, which was approximately 2 weeks after the original Sky News report, offers a number of statistics drawn from the Institute of Physical Studies. These graphs have looked into different attributes such as the predicted impact of coronavirus, long-term health conditions of minority groups and age relative to the white British population, as well as occupations and racism such as the ethnicity of NHS staff, which were not previously accounted for when the Sky News report was released. Sky correspondent Inzaman Rashid also states that despite the publication made by Public Health England, which should offer some form of recommendation to the government, we have seen that there has been no changes made. When talking to members of the BAME community, they found that they were angered by the lack of direct action to help protect their lives. In turn, let's see what our participants think.
I've never liked the term BAME because to me it just means like white people and everyone else, so it's just like meshing all kind of other ethnicities into these like 4 letters.
For me, it's kind of a new term for me. I've never heard of the term BAME before COVID, which is very strange to me, but I like the fact that in one way that they're grouping us all together.
BAME perhaps is a slightly outdated term now because it disregards Indigenous people and other minorities. The term itself seems to focus on just Black and Asian people, and even within Asian, like there's so many different types of Asian people. So I agree with a lot of other people that that term is perhaps outdated.
I do feel a little peeved that they use BAME because it kind of just groups everyone who is white together, which hurts a little. You know, they don't see us as us, you know, they just see us as the non-white people.
I can understand why they started using BAME. It's kind of like putting a label on minorities, but like I can see that it's in order to promote like diversity, but it kind of gets rid of like individuality within like each person, if that makes sense.
Yeah, well, like we can talk all day about whether people should use BIPOC or people of colour or BAME or any other one. I've heard a few others. Mm-hmm. But again, that's not the point. That's not really going to help us move forwards, I think.
I don't mind it. It's completely fine. But I feel like some people would be kind of offended by the use of BAME. It's like kind of putting a label on one specific group of like people.
I don't find it particularly surprising because there was a point, I think it was in the Sky report, where it was said that deprivation in general plays a large role in the deadliness of COVID-19 regardless of your ethnicity.
I kind of feel a lot of things about this report, and just because I think they dragged it out for a very, very long time and they weren't publishing it. And I don't think that's a very good thing to do, just because a lot of people in this country were being affected and still are being affected by COVID at the moment.
I think that statistic is much applicable to why the BAME community is much more affected by COVID-19, because if you think about the proportion of people and communities that occupy the lower end of the economic spectrum, so the working class. They're much more, you see a more minorities in that space compared to if you look at the upper classes, the middle classes, then you normally associate that with white people, right?
My initial thought, something that I want to raise, is that we knew that the government was doing an investigation into this because it came out pretty early on in the COVID pandemic that there was like a higher rate of deaths for certain ethnicity groups, and we were waiting for the government to put it out. And the reason that I read it as soon as it came out was because they actually delayed the release date. This was in the midst of the Black Lives Matter protest, probably when it was at its peak, maybe in June, I think. And I don't think the government expected a lot of people to be so keen for this report to be out. So when they finally released it, it was like everyone was sharing it in my circle, and it was something that we were all reading like on the day of, like within my network. So yeah, when it first came out, that was the first thing. It was like, wow, they actually released it, because a lot of people complained that they were withholding this information.
It actually frustrates me. That's how much, like every time I see the report, I think they just personally dragged it out a little bit too much, and they haven't given anyone any solutions. They've just given a whole bunch of research and put it out there rather than coming up with something that could help people.
It's a case of inequality, but it's sort of like, in this case, it's not solely racial. It's a lot to do with economics and economic inequality that exists in the UK today.
I've had quite a few relatives who passed away from COVID-19 quite recently, and it's really affected my family. And like, it is as bad as it sounds like on the media, and it just seems like it's mostly, I don't know, because the people around me are people of color, Asians, Chinese people. So to see, like, I only see like Chinese people around me being affected by COVID-19, it's quite upsetting. And it has made people, or like in my community, quite worried about going out and sanitation and hygiene.
Not personally, no, thankfully, actually. No, I don't.
Or have you heard any stories from people in the
I have heard stories, yeah, I've heard stories about people.
I mean, I've been affected, and my mum's been affected. Like, my whole family's been affected. Like, my mum had COVID-19. We had family friends, close family friends had COVID-19. Like, my mum was, thankfully, she recovered from it very, very quickly. She recovered from it within a week. But I do have some close family friends. Like, we had an auntie that was affected by it, and she was in hospital for like 2 months. And her lung collapsed, and so she had to be put in the ICU. But my mom just, self-isolated and was fine.
So me personally, like within immediate family and things like that, no. But I know a lot of people in my area, because I live in one of the top 10 areas where you're most likely to be at risk of getting COVID. So there were a lot of people in my area, on my road, things like that. So friends, their families, a lot of people have been affected by COVID. It's just scary because it's just so close to home, like down the road. So, yeah.
If you think about it, like, everyone to a certain extent has been affected by COVID-19, not necessarily from like just a physical and a medical point of view. Like, I think something that goes unnoticed, especially if we're very privileged, is the economic impact that COVID-19 has had on many communities. Thankfully, I'm privileged enough that it hasn't affected us too badly, but I know that for some people and for some communities especially have been hit the worst by COVID-19. In all honesty, I don't think interactions with the BAME community will be impacted as much.
I think perhaps it shows that we need to stick together, since a lot of the problems that we face are the same. So we need to be more united and work together to find better solutions that solve all of our problems. Because a few of the things that the article highlighted, there may be obstructions with language barriers. So people of colour or immigrants perhaps can't access services because they don't speak English very well, or they don't speak the languages of their country very well. So we could work together to try and solve those problems, maybe hold workshops and just assist each other.
Our community and maybe even our government should pay more attention to, because I guess like the BAME community is more at risk, so we should be more attentive towards these things and try to find ways of resolving that, I guess. But I'm not really sure.
As a whole, like the BAME as a whole, I feel like Asians more in general will be affected by it, but that's less because of this article and more with regards to racist views on COVID-19 and its origins in China. But in terms of like the article in and of itself, I don't feel like Black people or other minority ethnics like South Asians or like Middle Easterns or Arabians will be affected as much, because if you think about it, like the article just highlighted that COVID-19 was highlighting and exposing the inequalities that existed for the BAME community, but nothing was done to tackle that. And I think that's going to be the same after it. Nothing is going to be done in terms of the treatment of BAME community with regards to COVID-19 then, and nothing will be done after it.
Because when I first heard that people of colour were more likely to be affected by COVID, it didn't really make sense as to why that was. Because like the virus doesn't care what colour you are, it doesn't care how rich you are, it affects everyone. But then the science proves that it does affect people of colour more. When you think about it, the reasons would be things like people of colour get less job opportunities, in turn that makes them more poor, then they have like worse nutrients and like diet reasons and things like that, and then it just trickles down and it affects their health, and then next thing you know, they're more susceptible to viruses like this.
So I thought it was really interesting to see what everyone had to say about the term BAME. It shows that within our communities, there is such a wide variety of opinions. For example, Nabila mentioned that she thought that the term was outdated, yet it was necessary for data analysis. And Lily feels like the term just lumps all non-white people together. Natalie actually said that she felt that the word wasn't inclusive enough and that ethnic minorities might feel like others in our society. Whereas people like Kim feel indifferent to the term BAME, and Ari wasn't even aware of the term before. I kind of relate to what Natalie said about not fully understanding what BIPOC and BAME stand for, and she makes a valid point at the end about the BAME term on census forms and how there is just one umbrella term for minorities. So what about you, Sophia? What did you find interesting?
So actually, I was particularly struck by what Natalie had to say. She mentions how the information provided by this report was not exactly anything we didn't know already. And with many others like Ari, Alia, and Benza, who stated that they were not very surprised given the circumstances we face as a community. And taking into consideration of socio-economic factors, it's commonly seen that more minorities fall under the lower socio-economic background, which in turn signifies the higher statistic, whilst the upper middle class are usually white people, overall demonstrating the economic inequality between the communities.
Yeah, Natalie also spoke about how the report was meant to be released earlier. The government was essentially sitting on vital information that could have been instrumental to BAME. However, they pushed back the release of their findings because in late May, it was the peak of the Black Lives Matter movement and protests. Therefore, as a result, the report was published later than it should have been, and this caused a backlash from people for obvious reasons. According to a Guardian article published back in June, they claimed that ministers were not taking the lives of BAME Britons seriously. This report, along with the BLM movement, reinforced the large issues that Black people and ethnic minorities are facing in the UK.
In relation to your point, if we go back to the context accumulated from the Sky News report, many participants like Benza, Kieran and Steph also disapproved of the lack of action taken by the government to help those within the BAME community. With a number of those in the community working front-facing roles such as healthcare and retail, they have been put more at risk. Additionally, as Benza mentioned, there is no shielding programs for BAME, which should be considered as well.
The report listed a bunch of reasons for why BAME were at a higher risk of suffering from coronavirus, such as existing health problems and socioeconomic factors. But in the interviews, people pointed out that there weren't any changes being made to better improve the situation for immigrants or ethnic minorities. And that seems to be the general consensus of our participants, who kind of have a pessimistic view on the government and their lack of commitment or care for our communities, possibly from past experiences. From what I gathered, people were not surprised at the findings of the report. However, they were surprised that the government even bothered to conduct this research. And if you take situations like Grenfell, it is a prime example of how the government disregards the BAME community, who largely constitute the working class and poorer people in society.
So actually in recent news, there has been an update from Sky News stating a call for BAME candidates to sign up for vaccine trials due to being of high risk for COVID. So far, only 11,000 volunteers, 4% of which are from Asian communities, and less than 0.5% of whom are from Black, African, and Caribbean backgrounds, have signed up for this trial. So how do you as the audience feel about this? Would you consider signing up for a vaccine trial? Why or why not?
If you have any opinions on BAME, whether you agree with using the term or not, you can reach out to us on social media and share your opinions. Also, if you want to get involved with season 2 of the BAO Show, please feel free to contact us. Our social media is bamnbeyond, that is BAMNBEYOND. We are active on Instagram, Twitter, and Facebook. You can buy us a bubble tea via coffee if you want to support us and fund our future endeavors. Please like this video and subscribe to our YouTube channel and leave a comment down below.
Also, don't forget on the BAME Beyond Instagram, we also have a filter for the BAO Show, so please check it out. And don't forget to tag us when you use it, as we'd love to hear all of your thoughts on the different topics. If you want to come and chat to us about this topic or anything more, you can also join us for a discussion on our Discord server. And on that note, thank you for watching, and we hope to see you again soon.